Good afternoon. I want to welcome all of you for this short Facebook type of town hall and communication from the mayor's office, just to update you all that may be watching and paying attention to what's going on, to bring some more news to you. But definitely, we want to make sure that I want to say, God bless you all. God bless all of us. We're going through a pandemic here in our country, in our county, in our state, and also our city. A lot of people have fallen victims to this COVID-19, and we have lost a lot of heroes. But moreover, I want to thank those frontline fighters that's been fighting on the behalf of residents in our community. I cannot thank them enough on behalf of the residents of the city of Flint. If you know them, make sure that you say a prayer, send them a kind text. Our first responders, our nurses, our doctors, our fast food people who work behind the counter, who's making the food, the clerks at the bank, also the grocery store. Thank you, thank you, thank you on behalf of the city of Flint and its residents for doing the things that you have done. And for those people who we lost, my sincerest prayers go out to the family, and also we're praying for their souls and those individuals that we've lost. But we can only do what we can do to champion those individuals, and what we have to do as a community. We have to do everything in our power to make sure that we stay healthy. We have to continue to practice the social distancing. We have to continue to wash our hands. We have to continue now, by executive order of the governor, Gretchen Whitmer, to wear our mask in public places. We have to do everything to stop the spread of this virus. Here in the city of Flint, we are going to expand our testing protocols, expanding them to a couple more locations. We already know about the Hurley drive-through testing, making sure that we provide you with this information to get tested if you are symptomatic. Also, the Genesee Health System's mobile unit will be going out to test people who cannot get out to those sites. Hamilton Expanded Health Quick Care, will also be testing. More information about those testing sites will be coming out, and we're going to try to expand for more testing sites so we can actually do trace testing, making sure that we slow the spread of this virus. Today, I'm extending the curfew for the city of Flint for a period of 2 weeks, and so we're going to extend it to May 15th. We cannot relax our standards. We are saving lives here in the city of Flint. We know that Black and brown communities and more impoverished communities are experiencing the biggest brunt of the blow of this pandemic. We have to do everything in our power to safeguard life. The economy of our country, our state, our county, and our city is falling victim. But what we don't want to have is a death deficit. That is a deficit that we can never overcome. Right here to my right, I have Dr. Lawrence Reynolds, who's been contracted to work with the city of Flint to be providing health advice for us. He's been guiding us through, and through his leadership and his guidance, we have saved lives with our proactive activity versus reactive activity. Dr. Reynolds, you have been a champion here for us in the city of Flint. And would you like to expound upon what needs to happen in some of our testing sites?
Oh, yes. Well, first of all, you see, I have a mask on. I put it on when I leave the house, and I take it off when I'm in my car alone or when I go back in the house. Uh, there are things that we must do. Now, just because I have a mask on, you still must wash your hands. I recommend that you wipe off surfaces in your home, surfaces that you use on a regular basis, that you do not share food. But the most important thing is, if you have a medical condition like diabetes, high blood pressure, a lung disease, that you take your medication and you stay in contact with your doctor. People look and say, well, why is the number of black men so much higher than everybody else? It's the combination of diabetes, hypertension, heart disease. If we don't take our medication properly, if we don't stick to our diet properly, that puts us at greater risk. And we always have to remember, whatever we do in this situation affects the people around us. One person with an infection spreads it to at least four other people. And now we know that there are carriers who have the virus but don't have the symptoms. So we must protect each other. And so even if you have the test and you're negative, put on your mask, wash your hands, stay in, observe all those precautions because everything we do affects our neighbors and affects our families.
And with that, when we talk about the new testing sites that's coming up and also the expansion of the curfew, the reason that we're doing that is because we want to make sure that we can also quarantine individuals that have been tested for a period of time. As our state slowly starts to open back up, as our country slowly starts to open back up, in those spaces where we have to work closely with one another, we want to make sure that we're safe. And so we want to expand our testing sites as well as extend our curfew in order to work in conjunction with the idea of making sure we can quarantine the people that has been infected by this virus, and then also to make sure when we open back up as a state, as a county, as a city, that we all have a level of comfort that those who are working to the right of us or the left of us are not carrying the virus. Was that pretty accurate, Doctor?
Yes, sir. And might I add, if you smoke anything or vape, stop. It damages your lungs, and that is the area where we see the most damage. But this virus affects so many organs. The longer this goes on, the more we learn. But why would you smoke and vape knowing that these things damage your lungs and affect the people around you? So through secondhand smoke. So if you can quit, quit. Call the state quit line. But you have to protect your health.
And with that said, this is the eve of the 6-year anniversary of the water crisis. We have to do everything in our possibility to make sure we have our critical water infrastructure repaired. We are not far along as we need to be. We're continuing to work toward that goal. This administration is trying to make sure all the things that has been agreed upon with the EPA and the Eagle will be accommodated for the empowerment of our community. We have critical infrastructure needs, and we're working very hard. This administration is working very hard to get that done. The job of building and completing the secondary water delivery system was scheduled to be completed in 2019. That project has not even started yet. We're working very hard to get that project underway. So keep it in prayer that we will move this project moving forward, honoring the agreement that was made with the EPA and Eagle to be able to finish that secondary water supply source to the residents of the city of Flint. That was funded by the high-minded legislators in Washington, D.C., which gave them about $100 million, and remaining is a $77 million in the wind fund. It doesn't cost taxpayers anything. So any misnomers out there about this costing us anything, it's not true. This is fully funded by the federal government. It was agreed upon in the previous years and was scheduled to be completed in 2019. We have to get that project done and moving. With that said, our city will slowly start re-engaging activities as normal as possible. Yard waste will start to be collected next week. So you can put your leaves in your yard bags and they will be collected. Big bulk items will start once again to be collected curbside. So as we recognize and observe the shelter in place, we can use some of this time to be able to do some of that spring cleaning and get those items out to the curb. They will be picked up. To do some things maybe in the yard, making sure you're just doing it in your yard and getting the yard waste and making your yard look good. Placing those on the curbside. That will start again next week. Also, soft restoration projects from the lead line service line replacements. That work is ongoing now with our contractor and our vendors. The cement work, as well as the soft replacement, which is the yard in the parkway that was tore up, that is ongoing, and those vendors are out there performing those services to restore your yards. I know it's been a long time coming, but this administration will get it done for you. With that said, I want to also thank our friend Sarah Houston here to my left for the hard of hearing and deaf community for being here with us. And also, I want you to take a look at our proactivity about what we've been doing in the city of Flint. If you can look at the slide, the city of Flint's response to COVID-19. We're the only city that has hired a person to guide us through this process, which is Dr. Reynolds. We're the second city to declare a state of emergency in Michigan. We declared an emergency 8 days before we knew or had the positive case of COVID-19 inside of Genesee County. We launched the water reconnection 16 days before the declaration was made by our governor. Michigan is the only city that we've created the water assistance payments, utility payments program for our residents, meaning that we match you dollar for dollar up to $75. Those funding streams have been exhausted. We're going to be looking at ways to try to replenish those funds to be able to assist you through these very difficult times. I know we have some people that's been disconnected from work. We have some people working in the service providing area that has been laid off. But we want to do everything in our as possible to help you through this very difficult time. Once again, we're going to institute an extension of our curfew, which has been working well. Our overall crime is down in our community. But if we want our state to open back up, we have to do the things that's necessary that where our scientists and our medical profession tells us to do. The quicker we do those things, the quicker we can get our community to open up. So when we talk about wearing our mask, I keep one here, and we have to wear these masks. If you don't have one that's been manufactured, you can do a homemade face covering like Dr. Reynolds. With that, I'll take a few questions from you all before I bid you a good afternoon.
Could you repeat the numbers that are available through the public health navigators and what services are available there?
The public health navigators have been taking calls so we can make sure we get water to those that's most vulnerable. And I want to ask you to make sure that we only call this number to get water delivered to the homes of those individuals that cannot get out and get water at any one of the help stations that we have. That number is 410-2020, 410-2020.
And then last question, how long will this last? How long will this emergency and the quarantine last?
Well, as I stated, this will last until we can actually get control of where we are to suppress the spread of this virus. We're doing all things necessary based upon the medical profession and also the scientists giving us the advice. The rest is left up to you. You have to adhere to these things. Social distancing, wearing a face covering, washing your hands, and a shelter in place, and a curfew. If we can do that for a short amount of time, we will get quicker to our goal, which is to have everything open back up. But those are determining factors until to make sure that we get to that particular place. Anything on that, Dr. Reynolds?
Yes, and when it's time to go to the grocery store, don't take lottie-dottie and everybody. Just have one person go in that store because you're protecting people in the store, but you're also protecting your family, and you allow other people to get serviced also. So everything we do as Flintstones affects another Flintstone and our neighbors surrounding.
We don't want to lose another life inside the city of Flint, Genesee County, or anywhere in America. We all have to be responsible for one another as we make sure that we don't spread this virus or try to contract this virus by not observing to the recommendations from the health community. We've lost a lot of people, a lot of loved ones, a brother, a sister, a mother, a father, a nephew, a cousin, a neighbor, or a friend. We all have been touched by COVID-19 in a negative way. We all have to band together to fight together in order to win together. Let's honor the fallen by honoring them with making sure that we stay healthy. I want to thank Dr. Reynolds. I want to thank Sarah Houston. I also want to thank you. And if you're of the praying people, please, please, let's keep each other lifted in prayer. Thank you for taking a moment out of your day. God bless.